Hi, it's December 18th, 2021. I'm not going to post all the videos to Facebook. They're all going to go on YouTube, though. I am going to post this one on Facebook just so everybody knows if they want to see more of them. YouTube is probably your best bet. If not, that's okay, too. But I figured I'd talk about our journey so far with the pancreatic cancer. A year ago yesterday, we noticed I was really, really yellow. I was jaundiced big time. Scott had me go to the doctor's office. They sent me out to the emergency room at West Shore. And then they did a scan, found a mass around my bile duct. They were unequipped to handle it, so they had me transfer up to Traverse City. I then, the next day, I believe it was, had a stent put in to clear my bile duct, so that my bile was, we were getting rid of it, because I was already in liver failure, because of course I waited too long. And then we found out we had to get another stent put in 2 days later. It was a Friday, and that one worked. My bilirubin started going down. It's still yellow, but not as yellow. But they did discover at that time that it was pancreatic cancer. Fast forward a little bit, we've seen the oncologist who sent us to Dr. Nathan in Ann Arbor at MSU. Or no, U of M. I get that stuff mixed up all the time. And he said that he wanted me to do 4 months of chemo. And then he wanted to do a Whipple surgery. So I did the 4 months. Very, very hard to do. I had to quit one of the chemos because every time I took a step, it felt like I was walking on razor blades. But I kept up with the other two for 4 months. And then we'll let my body heal from the chemo. And then June, I had the Whipple surgery, which is a long procedure. Mine took over 12 hours. They took out part of my stomach, part of my small intestine, the head of my pancreas, which a Whipple wouldn't have worked if it would have been any in the body or the tail, but in the head, you know, we figured we had a good chance. They also took out my gallbladder, part of my bile duct, and reconstructed a portal vein. So all that got put back together, and I was glued, not sewed. They glued the outside of me together. Scott, I finally came back into the room. Scott got to see me for like 5 minutes, and then he had to drive all the way back to Arcadia, because I was only allowed one visitor a day. It was hard. I kept pushing the morphine button, but I swear I wasn't getting any relief. But I wanted to come home. And so I think I was there until Sunday. My surgery was on Tuesday. I was there till Sunday. They said 1 visitor a day, and even if the visitor only came for 10 minutes, that's all I got. So, I called Scott on Sunday when they finally cleared me to go, and I said, come get me. I hated being so far away from everybody. And so we got home. We were pretty happy about it, because about 2 months later, Dr. Nathan called, and he said that he's pretty sure he got it all. The lymph nodes he took out, only one of them was had cancer in it. I think that was out of 19. So we were feeling pretty good, and I had to wait 6 weeks before I could start doing anything strenuous, and then I went back to work as much as I could, because he did, Dr. Kohler, the oncologist, wanted me to do another 6 months of chemo, which I wrestled with, but it wasn't as bad a chemo. So I had to go in to get infusions, but I also took pills here at home too. I was kind of on a commission for a couple days and had somebody help me and all that. And we thought it was getting better. Once I started the new chemo, though, I started having a hard time breathing once in a while, and we figured, well, it's just the chemo. And then after the chemo, things were going really, really good. I didn't have the energy like I did before the cancer, but I could do stuff, and it felt good to not just be laying around doing nothing. So, I had a clean scan. I think it was in February. And then I started helping out at the Portage Point Inn on top, Portage Point Resort, plus doing the Travelers Motel. I didn't get a whole lot of hours, but I got some. And it was good to finally be bringing in some money other than SSI. And, we had another good scan in June. Perfect. I had a really nice summer. It was, I only worked like 20 hours a week, so it was, they kept me low because they wanted to make sure I was going to be okay. And I know I was still having problems breathing. I'd make a bed and I'd have to sit down and catch my breath. It's crazy. But, of course, with the aggressive cancer, like pancreatic, you have to do the scans every 3 to 4 months. So October was my next scan. And I went ahead and, got the scan. I figured everything was okay. I didn't think anything was wrong. I had like a urinary tract or kidney infection that I'd found out at my doctor's appointment, my regular physician. And so I figured, because I was having some pain in my back and stuff, and that's what I figured it was, a kidney infection. And that's what the urine showed. But when they did the scan, and I'm one of those people that can't wait till the doctor calls me to let me know what's going on. So I have a patient porthole for just about everywhere I go. And I opened up the scan, and it said that I had a 10.8 centimeter mass that looks like it came from the pancreas, but it was over by my left ovary, which I found out online. So I'm not going to, don't quote me, but this is what I heard online. It's only about 2% of pancreatic cancers will move over to an ovary. Usually they go to the lungs or to the liver. I also had a couple nodules in my in my lungs. But that 10.8 centimeter, that's softball size. That was a little bit to worry about. So I called the doctor because I wasn't supposed to see him for another week. And I kind of was freaking out because I wanted to get seen right away. Because that's a big thing. And so they did. The next day I got to see her, and we scheduled a biopsy, which we did in Traverse City with the radiologist. It was between a a gynecologist surgeon person up in Traverse City, my oncologist. That's what they wanted done, so we could see if it was cancer, and tell if it was pancreatic from the pancreatic, or if it was maybe ovarian. So the radiologist was doing the biopsy, and he made me sign something just to make sure, because he said even if it was ovarian cancer, just sticking that needle in there and pulling out some could help. It would probably spread it, which I didn't really say that with the pancreatic, but I think that's probably true too. So now we get up. This part's a little funny. We go up there, and he's like, "Oh, I'm going to go through your back because that'll be the easiest way to reach it instead of trying to get through all my intestines and stuff." And so I'm like, "Oh, okay, yeah, whatever." And we get into the radiology room, where the CT scan is, because they had to do all this with a scan. And they're covering everything up but my butt. And I was like, oh, why is my butt sticking out? And the nurse says, well, didn't he tell you he was going through your bottom? I says, no, he said he was going through my back. And she's like, oh yeah, okay, that makes me the bearer of the bad news. And so I'm laying there on my belly, butt up in the air, and waiting for them to get ready for me. And so I couldn't figure out whether to tense the butt or relax the butt. I figured I better relax the butt. But they told me they were going to give me, what was that stuff called? What'd they give me? Fentanyl. Yeah. They gave me a fentanyl cocktail. I couldn't tell you if my butt was clenched or anything, man. I didn't feel nothing. I could have pooped on them and would have never even realized it. But they took out 4 cores of the thing, plus pulled out 170 milliliters of smoky white fluid. And we thought that was kind of odd. And eventually, you know, the test, I had the same thing, you know. I, of course, kept refreshing till I got the path report back. So, of course, I knew before my doctor did that it was cancerous. And it was probably from the pancreatic cancer, because it was consistent with that. I also had, you know, the nodules in my lungs, of course, but those were too small to biopsy, so... You know, with this being cancer, who cares about the lungs part? But that following Tuesday, we went in to see Dr. Kohler, and he said that I would have, if I did chemo, it would only give me possibly 6 more months. And I asked him, well, how much without the chemo? And he said 3 to 6. And the chemo was hard. And if he could give me a year, it would have been probably a different story. But I couldn't do chemo again. And with it being that big, they weren't going to take it out. Nobody will open me up. They won't even pull more fluid off, because that fluid ended up being an abscess, an infection. And I don't know if it's grown back or not. I get pain there. I'm assuming, I know it's spreading, and even the nurses and everything saying, you know, it's in my blood, it's coming up into my brain, all that stuff. So, we decided not to, well, I decided not to, and Scott, you know, understands. He went along with me because, you know, and we are trying some stuff that actually has improved my way of life. But we'll talk about that at a later time. We did do, we went on our honeymoon, belated honeymoon. We never had one. Closest thing we got was Skid Row at the casino. But we went up to Munising, because, of course, it has a Hardee's. But, you know, I will tell you about that, too. There is a bunch of videos I'm going to post, and I'm hoping to put them all on one thing, because it was funny. But then we took, the Fisk family took a vacation. There was 23 of us, and they took me down to Orlando. And to Universal Studios, which is one place I always wanted to go. So we've done a lot. Like I said, there is a treatment. I've been on it a week and a half. Yeah. Been about a week and a half, and I will probably get into that maybe tomorrow. I do have a Christmas party tomorrow. I am planning on going. I do have to use a wheelchair. Painkillers, you know, it's hard. I am on hospice now, as you can tell, my hospital bed. My TV, you know, my pot. My dogs. They're trying to help Mama feel better. And I have good days and bad days. But like I said, I will... And there was a point in time, about a week and a half, 1 week ago, I had to have Scott help me, practically carry me to the bathroom. And now I'm able to do it myself. So, I am excited to share what we've been trying. And we're praying that it gives us a miracle. Well, like I said, I'll tell you about that at a different time. So it's like I am over 14 minutes. But like I said, if there's a lot of them that'll be posted on Facebook. Little ones, big ones, messages. If anybody wants to hear about what we're doing, the treatment thing, just write me on this one, and I'll make sure that I post that for you, either on Facebook, or I can send it to you in a private message, or let you know that it's on YouTube. So yeah, I guess I could probably talk for another 5-10 minutes, but we're gonna stop. And I think I got everything out. We're on 2 months of my 3 to 6. After 3 months, we're going to count every day as a blessing. Actually, we're counting every day as a blessing now, too. because the way the doctor and oncologist acted, I wouldn't be able to do stuff like this at this time. So I'm excited that I might have a chance, or at least being around longer. So I'll talk to y'all later. Probably going to post a couple of things that were from like our honeymoon, and maybe a couple things from Orlando. And you never know, I'm going to try to find our wedding video. I'm going to post that too. I'm going to post a lot of stuff. You get tired of me, just stop following me. It's alright. Alright, thanks everybody. Bye.